When you are feeling breathless while walking, you should not ignore. It means the fat is deposited around your lungs, upper airway tract, around the heart, and it is depositing in the liver.
So, doctor, you must be seeing thousands of patients. What toll does this obesity have on mental health of people?
When you're obese, now it's Instagram world, so every day you need a picture. So one is the cosmetic, you should look good. Number two, a lot of young girls come to my OPD, like they're 100 kgs, marriage is an issue. There are some patients who got married with obesity, but they are unable to conceive, infertility issues. And I feel 30% of patients who walk into my OPD who are obese, they are slightly depressed. So what happens is, once I do the surgery, those patients will lose weight, they get married, they conceive naturally with infertility. Whatever we take today, it is going to harm not immediately, in long term. So that's the reason we don't try to do any shortcuts in building the body.
As a nutritionist, many people ask me, how do I lose weight? And sometimes we always talk about simple food changes, simple exercise changes, and simple sleep changes. But many a times it goes beyond the simple. Sometimes it's metabolic, sometimes it's your genetics. And then came along Dr. Moinoddin, who came across and said, you know what, Mr. Fernando, let me explain to you and millions of people why certain people struggling with obesity need a ray of hope. So without much further ado, let's get into this video. Dr. Moin, you're one of the doctors who actually should not be in my podcast room because I am going to get trolled for this podcast that how can you invite a competitor into your podcast? But ladies and gentlemen, please understand, knowledge is power. And when you have knowledge, you can make decisions that change your life. Dr. Moin is a bariatric surgeon. We nutritionists say, get your diet in check, do exercise, we can control your obesity. But there will be people out there, and I know this as a nutritionist, that will require intervention from the medical community. Be it a drug, be it a surgery, be it a doctor's calming, soothing words on what could be the best course of action for you is always a journey that you should seek and consult. Remember, trying to self-prescribe any disease is the worst thing you can do. You have experts like Dr. Moin. You have experts like Fernando. Today, our conversation is going to be about how you can take charge of your life if your weight has been an issue for you for many, many years. Dr. Moin, welcome to my podcast. Nobody's going to troll you, and I have deep, deep respect for what you do.
Hi, Ran. Thanks for having me here. So I was always thinking we should have a podcast where these two antagonistics sitting each other and contradicting each other points and all. So definitely I feel like privileged to be in your podcast, but I was seeing you're doing a fantastic job with from quite a few years. And
Thank
I
you.
want to know, like there is other part of the spectrum where it is unaddressed, like people who fail the diets and all. And people who are very morbidly super obese, where diet doesn't work much. For those kind of patients, I'm always there.
I have two examples to give you. The abuse of steroids in the bodybuilding world to get a body. And you never find doctors abusing steroids. And they're the most intellectual group on the planet, saving people's lives. Why don't they, why can't I see all bodybuilding doctors in surgery chambers? Because you understand the benefits as well as the side effects. You can make what we call as a medical decision.
Correct.
on the saving of a patient via medication or surgery or absolutely no intervention sometimes.
Maybe I feel that doctors think of long-term consequences because we study to medicine and MS and all these things for 10, 15 years of our lifespans we spend in learning. So we always think that whatever we take today, it is going to harm not immediately, in long term. So that's the reason we don't try to do any shortcuts in building the body and all. We think long sustainable thing is the main thing. That's what I feel.
In fact, once I had a diabetic patient,
Okay.
and he said, I don't want to take medication. And I was like, sir, you need to take medication. This is my diabetologist number. You're going to call him. You're going to take the medicine. No, Mr. Fernando, they say diabetes is reversal. I'm like, sir, that was when you were 25 years of age. You are now 60 years of age. You first meet the diabetologist. You get the medication. You get things under control. and parallelly you work on your diet, which is the same reason why I have you today in my podcast, is to pick your brains on what anyone who is on the heavier side, they will ask these questions, that should I be doing bariatric surgery or not? So before I get in,
Yeah.
what's your background for the world?
So basically what happens is I have done my MBBS and Masters in surgery from Andhra Pradesh. I'm an Andhraite. So afterwards I did my lot of fellowships from Mumbai, South Korea, Taiwan, Belgium, Ahmedabad, Delhi, so many places. So my focus has been always in one thing. Because if you go for a knee surgery, it relieves only knee pain. If you go with a heart surgery, only the heart condition is corrected. I always wanted to do a surgery where it corrects many issues. For example, I do a bariatric surgery where it corrects your diabetes, it corrects your blood pressure, cholesterols, PCOD, knee pain, back pain, snoring, breathing difficulty on walking, lung issues. And even if you really see the FE1, we calculate pulmonary function test you write for the patient. So that also improves post-bariatric surgery once you lose weight.
For those who don't know pulmonary, you mean lung function,
Yes,
right?
lung function. Just like kidney function,
Yeah.
KFT, kidney function test, LFT, liver function test.
Yeah.
We have pulmonary function test where you can quantitate the amount of obstruction you have, amount of restriction the lungs are going through.
Bariatric surgeon, right? I saw some of the videos wherein I've actually seen post-surgery, you're dancing with your patients.
Yeah.
Okay, so
Correct.
before I talk about surgery, what is bariatric surgery? Why was it called bariatric surgery?
Yeah.
And how did somebody decide to do this sort of surgical intervention for metabolic disease?
Yes. Yeah. Basically, the bariatric surgery is derived from the word called baros, which means overweight in a different language. The surgery done to treat overweight is called bariatric surgery. It's quite clear. Baros means overweight, surgery. But they have not texted the contest as obesity, but overweight itself, people call it as obesity, whatever it is.
And doctor, overweight in your dictionary as a doctor, when a patient comes to you, what is that BMI or overweight category that you say that this person is a candidate for bariatric surgery?
So what happens is different people have different heights and weights. So we don't decide depends on weight. Depends on height also. So there is something called weight in kgs by height in meter square. You calculate a value called body mass index, which we can do in any gyms and all there. You get a specific value. If the BMI is less than 25, it is called normal weight. If BMI is 25 to 30, it is overweight category. If BMI is more than 30, it is obesity category. If you have to do a surgery, the BMI should be minimum 32.5.
So candidates above 32.5 BMI. And they should have been holding that for many years.
Yeah.
Correct?
So definitely you hold for many years, you get diabetes, blood pressure. So they qualify more for surgery. So 32.5 BMI with along associated with any metabolic issue like diabetes, blood pressure, cholesterols, PCOD, anything qualifies for surgery.
So doctor, here's the thing, okay? When you get a higher BMI, correct me if I'm wrong, all-cause mortality increases via heart attack, BP and all. Therefore, as a surgeon, sometimes surgical intervention after maybe trying diet with Ryan Fernando, exercise with your trainer, and you've done it for many months, you're not shifting the weight downwards. Do you think that is something that is saving the patient's life, giving them a longevity?
Correct. So before the word was bariatric surgery. Now it is clearly it is a metabolic surgery because my surgery is going to correct the metabolism of the patient. For example, if you have diabetes, if you have blood pressure, if you have cholesterol, it is called metabolic syndrome X. This metabolic syndrome X with overweight or obesity definitely qualifies for the patient because this X is going to be deadly for the body. Because one side, your diabetes is increasing, the clotting mechanism in your heart, the hypertension is increasing, the clotting, atherosclerotic plaques in the blood vessels, the cholesterols is coagulating, the cholesterol crystals are accumulating in your heart vessels. This will cause either a brain stroke or cardiac stroke. So we see a lot of patients with metabolic syndrome X going to that level. So
how do we identify this?
Yeah. Once you have to test the blood sugars, especially the fasting, and you have to check the C-peptide levels also because C-peptide level is the capacity of the pancreas to secrete insulin. If your C-peptide level is less than 3, then you should be really worried about it because you're going to be diabetic in future. The earliest indicator is C-peptide levels. And fasting insulin. and postprandial insulin. How the insulin is released? Insulin is releasing in a good interval or not? And number 2, your blood pressures. Whatever people say, 130, 140, and once the blood pressure goes over 140, you should be really worried about it, because the more the blood pressure, it makes your arteries thick. The thickness of arteries increase, and you got a cardiac arrest. That's what you get, a cardiac stroke. So even this blood pressure will increase in brain, it causes a brain stroke. So cholesterols, for example, I'll tell one small story about it. One of my assistant professor in my college, suddenly he didn't turn up for the rounds. He's so thin guy. I mean, he should be around 65, 70 kgs. So people knocked at his door, but he didn't woke up. So after they opened the windows and saw he's dead inside.
Oh.
Then we saw the history. His father died at the same age. His grandfather died at the same age. So that is called familial hypercholesteremia. So those kind of patients should be very, very cautious. Even though he's not obese, but he still died with the condition called familial hypercholesteremia.
So basically his arteries got clogged up.
Clogged up because he has the history of it. So genes play a vital role. And those kind of patients, I definitely has to be kept in a tight supervision, because we should avoid any catastrophic events in our body. And definitely this obesity surgery started, how I'll tell you how it started. So one surgeon operated a patient for distal gastric ulcer. वो ज़माने में अल्सर बहुत ज़्यादा होता था, because pantoprazole ऐसे powerful medicine नहीं होते थे. So they used to have ulcers in the body because they never used to have any medicine for it. So उसके लिए सर्जरी क्या होता था? पहले छोटा सा पार्ट निकाल देते थे स्टमक का, जहाँ अल्सर है वहाँ निकाल देते थे. The surgeon started seeing post-op, this patient started losing weight.
Because he's taken a small portion out of
the stomach. Then, अरे मैंने तो अल्सर का सर्जरी किया था, ये weight loss क्यों कर रहा है? So then they related, there is something related between the size of the stomach and weight loss. That's how the surgery started on the stomach.
Okay.
Stomach में ये बाहर वाला abdomen है, अंदर वाला जो stomach bag होता है उसकी बात कर रहा हूँ.
Okay.
So that's how the surgery started. Even the top people who started this surgery 40-45 years, जैसे Scopinara हो गए, उनके भी recently मौत हुई. I mean, I want to say it has a very long history. But India में popular होते होते 2002-2003 के बाद popular हुआ है. मैं खुद 13 साल से कर रहा हूँ. तो what I feel is this surgery, any surgery comes into the market, it takes some time testing to grow the confidence in people. I think now it has grown a confidence and people are really confident about it now.
So the evolving of this bariatric surgery from taking out an ulcer. So today when I have patients coming to me as bariatric operated already on, they tell me I did this banding, I did that. So what are the different types of bariatric surgeries available for people?
Actually, there are 38 type of bariatric surgery.
38?
Yes.
I thought there are only 5.
Actually, 38 types. Why this term type of surgery started is, for example, if you really go into the population of Taiwan, those people are not very obese. This BMI is somewhere around 30, 35 kind of thing. In Indians, you see 50 BMI and all in those patients. For those kind of patients, a separate surgery is called PJB, DJB has come. If in Indian population, if you really see, 3 type of surgeries are very common. That is gastric sleeve, Roux-en-Y gastric bypass, mini gastric bypass. So if you really see 2 types, sleeve, bypass. Sleeve, what sleeve does is basically we reduce the size of the stomach. The stomach size is 100%, you will be eating this much. We reduce the size into 20%. So instead of eating this much, you will be eating this much.
So the stomach goes from 100 to 20%?
20%. That is gastric sleeve.
Okay.
You see a lot of people outside that models, giddles, they suddenly disappear for 6 months and they become thin for 30, 60 kgs and all. They have done sleeve. So
is this reversible?
No, it is not reversible because once you reduce the stomach.
Okay.
In gastric bypass, what we do is we don't remove any part of the stomach. We reduce the size of the stomach, join with the intestine. Before khana bade lambe route mein aata tha. Bigger part of the stomach, it's to fill the stomach, come into small intestine, come into jejunum. Now the food bypass, it's into a smaller part of the stomach, then it goes to the upper part of the intestine. So it is bypassing. So too many nutrients are not getting absorbed.
Too many nutrients are not getting absorbed.
Yeah, small absorption.
So that is where you and I need to have a jodi, because post-bariatric, people need to understand the quality of nutrition has to actually go through the roof.
Correct.
But you said 38 types are there coming back and mostly 2 types are done. So what will happen? You'll cut open my full stomach, open it up and then get in and I'll have all the scars and all of that stuff?
That is a misnomer. So what happens is, it's a keyhole procedure with a small keyhole, like 1 centimeter holes we put in the stomach. Some are 5 mm also. We put a camera inside and do the surgery. It is not cutting at all. It's a small keyhole surgery.
Is that why the patients are dancing with you 24 hours later?
Correct.
And discharge is how fast?
Next day we discharge the patient.
Next day?
Yes.
After cutting up the stomach?
Yes. I prefer to do a gastric bypass. Instead of cutting,
Okay.
I bypass the stomach. So I do the surgery, and the patient, most of the time, the patient will be walking within 2 hours after surgery. For example, if I finish the surgery in 45 minutes, within 2 hours, I'll make him walk. Next day, I discharge the patient. Before discharge, a small dance, if they are willing, with their consent, we can do it. Why we are doing this is to remove the fear about the surgery. What people think is, once you do a surgery, you will be lying in the bed for one week. Then you will come out of the house, small walk. No, nothing like that. The patient can dance next day itself. Just to prove that the surgery has a quick recovery, I started this thing.
So, doctor, this metabolic health often breaks down quietly. We get fatigue, stubborn weight, sugar cravings. What are some of the earliest signs you tell your patients not to ignore?
Yes. I feel when you are feeling breathless while walking, you should not ignore.
Okay.
Then it means the fat is deposited around your lungs, upper airway tract, and around the heart. And it is depositing in the liver, fatty liver. So if you get breathless while few steps, you should not ignore. Okay? Once you feel with a small work, you don't feel like doing any work, that you should not ignore. Understand, right? And you get tired very easily, you should not ignore. And you feel like eating 6 times a day, 5 times a day, then you should not ignore. If you feel lightheadedness, you feel too much of giddiness and too much of anxiety, you should not ignore. It can be early sign of hypertension. So you should not even ignore when you are snoring in the night. Snoring is not healthy. Snoring is always not a deep sleep. Snoring can be early sign of obstructive sleep apnea, which can lead into many issues.
And nowadays we hear so much about this insulin resistance,
Yes.
especially under people under 40.
Correct.
Why is it becoming so common and what is driving this shift?
You will not believe, Ryan, I see in my OPD, roughly around 25 surgeries I do per month. So I see 75 to 80 patients, obese patients coming to my OPD, 140, 160, 200. Some people will be carried in a wheelchair. Those kind of patients, they come to me. I will say, nowadays I see young people coming to us, 22 years diabetic. The HbA1c is 8. The reason here is, the patients, what happens, the partying culture has become too much. The weekend is loaded with too many calories, where what you're doing is, you are pressurizing your pancreas. You are stressing your pancreas. So the pancreas also has certain capacity to release the insulin. For example, you eat this much, my pancreas will release the insulin to reduce the sugar level.
That is that C-peptide you talked about, right?
Yeah.
Okay.
So if I eat this much, I am stressing my pancreas. How will the pancreas release? इतना तो खाने के लिए बना नहीं हमारा pancreas. तो pancreas goes on toss. The beta cells damage start हो जाता है. Insulin production थोड़ा कम हो जाता है. It will not reduce completely, थोड़ा कम हो जाता है. That is one of the thing. And in obese patients, what happens is, insulin is produced by pancreas, but it is not getting absorbed by the tissues. Tissue absorb नहीं होता. इसीलिए इसे resistance बोला है. The tissue become resistant for the insulin. That is an insulin resistance. So that is one thing. And पहले हमारे ज़माने में मेरे बचपन में कुछ खाना होता तो थोड़ा सा एफर्ट लगाना पड़ता था. अभी सबके पास पैसा है. 1 क्लिक में जोमेटो ये वो सब आ जाएगा आपको. खाना आपके सामने मिल जाएगा. Food accessibility has become more. And even the calories consumption and the midnight cravings, which is a serious thing to worry about. हमारे ज़माने में रात के 8 हो जाते थे तो सो जाते थे लोग. अभी उनके रात शुरू होती है 8 बजे. 3 बजे 4 बजे whatever.
For someone who's pre-diabetic, because in our nutrition clinic, we get a lot of people doing their blood tests and like, sir, my HbA1c has gone up. It is already 6.5.
Correct.
How important is early intervention? And can pre-diabetes be reversed for good?
Yes, 100% can be reversed. Because pre-diabetic का मतलब ये है कि your insulin, whatever produced, tissues started rejecting it. The tissues are not absorbing it 100%. The tissues are absorbing partially. So what happens? You are going into insulin resistance. How do you know that insulin resistance means? You started developing pigmentation around the neck. You started getting dark patches here, in the temples and all this.
So that dark patches is actually related to insulin.
Yes, it is. It's a kind of acanthosis nigrans.
Okay.
This is the first sign of insulin resistance.
So then when you're in the airport and all, you're traveling, you must be looking at that, hey, you have insulin resistance, you have bariatric for surgery. So you can actually identify people.
Yeah, early signs, yes. And one more the time is you started getting fat around your belly. That is one of the sign of insulin resistance. I mean, pre-diabetic. Insulin resistance is first sign of insulin is pre-diabetic.
And when you do the bariatric surgery, have you seen an insulin-resistant patient, diabetic patient, reverse their diabetes?
Yes. Post-surgery, what happens when you, for example, you go to a diabetic doctor. If the patient is 100 kg, he should be around 80, for example. He's 20 kg overweight. The doctor will say,
lose weight.
Sir, आप 5 kg lose कर लीजिए, आपका इंसुलिन अच्छा हो जाएगा, आपका HbA1c ड्रॉप हो जाएगा. वो 5 kg की बात कर रहे हैं. मैं सर्जरी के बाद 30-40 kg की बात कर रहा हूँ. तो इनका HbA1c, I have documentation reports where the HbA1c has gone from 11, 12 to 4.55. HbA1c drops slowly.
So, sir, I have a question. Okay, you have the nutritionist, dietitian. By do diet, take good exercise, take good sleep, change your eating patterns, because we know the eating patterns where the obesity has come in.
Correct.
Second is the new drugs that have come in, the GLP receptor drugs, that the endocrinologist will do the prescription.
Yeah.
He also understands all-cause mortality. It is better for him to lose weight because I know this banda cannot go to Ryan Fernando and work out or do diet plan. And the third is we require bariatric surgery. Now, in all of these three, somebody has diabetes with me, somebody has diabetes going to endocrinologist, somebody has diabetes going to the bariatric surgery. In all of these three, where do you see people at? Like, which is the case where you'll say, bhai, aap exercise kar do.
Correct.
Which is the case you will say, take a drug, and which is the case you will say, do the bariatric surgery.
Correct. Actually, every patient who walks into OPD, we don't do surgery for them. Because some patients are just overweight. Some patients have started early metabolic issues. Some patients are very morbidly obese, which we consider surgery for the first attempt. So patients who are 25 to 30 BMI, still their BMR is good. Basal metabolic rate is good. We definitely send to a nutritionist because we also have a nutritionist on our team. Number two, endocrinologist, whose diabetes is not getting controlled, even though they are less than 30 BMI. Even though with diet, lifestyle, the diabetes is not getting controlled, they can definitely go for GLP-1, GIP. I'm not suggesting wrong with them. But the problem here is once the patient is morbidly obese or 35 plus BMI, trying the other things may not work for them because weight is very subjective for everyone. For example, if I'm 100 kgs, I may be comfortable. Some may be 80 kgs, they're not comfortable. So weight is very subjective. So the patient who is really worried about his health, he should really go to a person who is concerned. For example, the BMI less than 30, he can opt for anything. He can opt for diet, lifestyle, definitely ABC, lifestyle and all. Then if he has diabetes also, which is not getting controlled, even with life and dietitian and all, then definitely they can opt the medicine and all these things. But they should opt initially. What I feel is any medicine for a long time is not good. So you should see the calculated risk in the long term. So use it for some time. If it works, it works. I think you should always come back to lifestyle modifications. It's a permanent way of doing because आपने 3 महीने कुछ कर दिया, उसके बाद 4वें महीने में आपने खाना खा लिया, go partying, eat whatever unhealthy you want. It doesn't work like that. It's a lifelong discipline which has to be followed.
Doctor, you said something about people being comfortable at 100 or some people not being comfortable at 80 kgs. Now, nearly 1 in 3 Indians is either obese or overweight. हमारा प्रधानमंत्री ने बोल दिया मोटापा कम करने के, तेल 10% कम करने के.
Correct.
But there's another part which is there's an emotional impact which is not addressed. You must be seeing thousands of patients. What toll does this obesity have on mental health of people?
When you're obese, now it's Instagram world. So every day you need a picture before going to work. So after coming from work, you take a picture. So one is the cosmetic, you should look good. Number two, a lot of young girls come to my OPD, like they're 100 kgs, marriage is an issue. There are some patients who got married with obesity, but they are unable to conceive, infertility issues. And some people who has a big tummy, everyone, joke starts anywhere, ends there. So a lot of things are there. So they're depressed. And they don't know where to go. So they're really depressed and some amount of, I feel 30% of patients who come to walk into my OPD who are obese, they are slightly depressed. And I see recently a guy who is 32-year-old. So he's taking almost 12 medications for antidepressants, antipsychotics, and all these things. But I feel where this world is going to, because when you're obese, if the obesity is addressed, your half of the medication will come down like that only. So most of the patients are obese, and some people, they want to do so many things in their life they can't do. For example, you want to do paragliding, you will have a weight marking there. Beyond that weight, you can't get into the paragliding. And
I never thought about that one.
even the scuba diving.
Scuba diving also?
Yeah, because what happens is already the cylinder is so weight. I have done the scuba diving in Maldives, and what I felt is the weight of the cylinder is already there.
Correct.
And you are weight.
Yeah.
You will definitely go into a deep ocean. So that is also one thing, because if you're obese, that the shallow breathing is more.
I had a client who bought a Lamborghini and came to me and says, Ryan, sir, I need to lose 25 kgs
to get into the
to get in the Lamborghini.
So like that. So people are depressed. So what happens is, when they're morbidly obese, and once I do the surgery, those patients will lose weight. They get married, they conceive naturally with infertility. And I think we have some of my friends who got few girlfriends post surgery. So, so wives watching there, they should be really worried to send him for surgery, because he's going to be extra,
or maybe the wives could
extra
get
handsome.
or the wives could get the bariatric surgery. Speaking of wives, in menopause, a lot of women have rampant weight gain.
Correct.
Are menopausal women also a candidate for bariatric surgery?
Yes. So actually, there is no age limit. Before, they used to come to 16 years to 70 years, but I feel there is no age limit for bariatric surgery. The youngest bariatric surgery is done in Gujarat, 4-year baby.
4-year-old toddler?
Baby. Yeah. The reason is, she had a syndrome called Prader-Willi syndrome.
Okay.
Prader-Willi syndrome is the baby puts on lot of weight, especially in the upper part of the body, where the breathing difficulty becomes very prominent. The baby will be like this.
Okay.
So what happens? To save her life, they're done bariatric surgery.
Okay.
So there is no age limit. The youngest I have done is 12-13 years. So the oldest I have done is 78 years.
So what is the weight range of these people who are the youngest?
So for this surgery?
Yeah, the BMI. Yes.
Yeah. The BMI definitely, again, it's same thing, say 32 point. But what happens is, if someone's body is crippled with weight, we can consider the lower BMI. 30 plus also we consider.
Understood. So let's talk long term. You know, I've been a nutritionist for 2 decades now.
Correct.
A lot of people have lost weight with me. Few keep it off for decades.
Correct.
Now, why does the body resist weight loss? Or is it only about willpower, maintaining their diet and exercise?
Actually, when you do weight loss attempts, as you are a celebrity nutritionist, you will be knowing, if you give a diet plan to a person, okay, he does first time very sincerely, very religiously, he will lose 30 kgs and he tries to maintain it. After some time, a party comes, a birthday party comes, एक केक खा लिया, फिर बाद में एनिवर्सरी आ गई, थोड़ा खा लिया, चलो कल खा लिया तो परसों खा लिया,
मालदीव जाएगा 2 हफ्ते के लिए, रायन का डाइट
फॉरगेट अबाउट इट, वहां पे कोई बनाने वाला नहीं होगा, आपको जो मिलेगा वो खाना पड़ेगा. In that way, they lose weight, they put back. And body, what happens is, the first chance is the best chance to lose weight. The second chance is a slightly lesser chance of losing weight. The third chance is slightly lesser than the second chance. That's what I observed.
Understood.
The body gives first attempt very nicely, even for the bariatric surgery. When you do a first bariatric surgery, they lose good amount of weight. Some people have done bariatric surgery multiple times. Even we do that.
Yeah.
Revisional surgeries, we call it as. The second time, they may not lose that much weight as they have done first time.
You know, as a doctor, in addition to the psychology, which research has actually proved, that people in the second and third attempt actually are less focused or less motivated to stick to the end result goal that they want. But as a doctor, you will know this very confidently, that the cell turnover of cells in the human body, skeletal muscle is 14 years.
Correct.
Fat cells is 8 years.
Correct.
So I think the problem over there is that fat cell always does exist. And controlling the tongue and the lips for food is very, very difficult for a lot of the population. But I have a leading question over here.
Yeah.
Instead of bariatric surgery, why don't I just do liposuction?
Yeah.
What is your take on that?
Yeah. Actually, bariatric surgery and liposuction are North Pole and South Pole.
How?
People think both are same. See, liposuction is removing subcutaneous fat. From the
You don't touch the visceral fat?
No.
Oh.
That's what I'm saying. The whole purpose of metabolic issues rely on the visceral fat.
Can you tell us what is visceral fat?
Actually, chalo, two type of fats. What is subcutaneous fat? This subcutaneous fat.
Under the skin.
Under the skin. Visceral fat is which is attached to intestines, livers and all.
So what you're talking about the fat is around the lungs also?
Lungs and everything is visceral fat, which you can't touch.
Okay.
Liposuction में यहाँ का fat निकालते हैं.
Doctor, जब you put that in the camera inside and you go in the bed, you are able to see the fat when you go in?
That's what I'm saying, sir. I'm lucky to be born a surgeon because I can touch the visceral fat like this. I can touch the fatty liver like this. I can touch the stomach like this.
And you're able to see the fat?
Yeah, I hold it while doing surgery. We see young girls, for example, yesterday's patient, 120 kg थी लड़की, so 40 plus BMI था.
40 plus BMI?
BMI था. There was this thick blanket of fat inside.
Visceral or subcutaneous?
Visceral. I'm not talking about subcutaneous fat at all. This blanket of fat. I'm telling you, I'll invite you doing a surgery. You just see how visceral fat looks like. How a fatty liver looks like. Because आज तक आपने स्कैन में देखा है fatty liver grade 1, grade 2, grade 3. आपने कभी टच नहीं किया.
तो आपका कैमरा स्टमक के बाहर है या स्टमक के अंदर है?
हाँ, एक्चुअली क्या है, abdomen के अंदर है. ये abdomen है.
So the full abdominal cavity.
This is abdominal.
So your camera can go and see.
Camera can see anywhere. अब जैसे इधर एक कैमरा रखा है 360 रोटेटिंग कैमरा.
Correct.
उस कोने में क्या है देख सकते हैं. उधर लिवर है देख सकते हैं. इधर यूट्रस है देख सकते हैं. उधर इंटेस्टाइन है देख सकते हैं. सब कुछ देख सकते हैं. सब दिखेगा.
Does the fat go on top of the uterus also?
The fat doesn't go on the uterus.
Okay.
Because the uterus is covered by muscle.
Okay.
Myometrium, we call it as.
Okay.
जहाँ से fibroids.
So mostly we see the fat in the abdominal cavity where it's sitting on the stomach, the intestines, the liver, kidney, and this is the difficult one to lose.
Correct.
So we're coming to the liposuction.
Yeah.
Doesn't touch this.
No, obviously it touches only below the skin level. It goes still below skin level. ये skin है, ये abdominal wall है. इनके बीच में जो fat है, जैसे आपका protrusion दिखता है ना, वो निकाल सकते हैं. That is a cosmetic procedure. It's not a weight loss procedure.
And you can't remove this fat off the internal organs, the visceral fat?
It can never remove.
Why is that?
You're physically removing it, right? You are not increasing the metabolism of the body.
So
With bariatric surgery,
it will come back again?
Obviously, it comes back again.
So you still have to come back to me for diet then. But bariatric surgery can control, right?
But I will not say that it will come back immediately. If it doesn't maintain properly, it comes back. But visceral fat with liposuction is not touched.
Understood. I did have a case of a gentleman who did a hernia operation.
Yeah.
And his doctor was his friend. So he removed a lot of the visceral fat that he could see.
Yeah.
And if I remember correctly, it was nearly 5.5 kgs that was removed. And I have the body assessment scale, which is the body fat percentage. So I saw the visceral fat drop drastically. But Dr. Saab, within 18 months, it all came back again.
Correct.
In spite of him working out and eating, because I believe he has a gene that stores more fat.
Correct. Actually, क्या है? If you really come to my clinic, you will see a lot of sofas there.
Okay.
So many sofas. So you ask me why there are so many sofas. You require one pair for the patient because his tummy will protrude out while he sits in the chair and all. I feel the obesity runs in genes. I strongly feel आज भी obesity is a hereditary issue. It's in genes. फादर मदर ओबीस हैं, बच्चों का ओबीस होना लाजिम है. पूरे बच्चे ओबीस हैं. ऐसे ऐसे फैमिलीज हैं, मैंने 8 लोगों को बैरिएट्रिक किया है, 10 लोगों को किया है, 12 लोगों को किया है. आई कैन शो दैट everyone in the family got operated. So that's the reason जब फैमिली आती है तो most of them parents are also obese. They also require a sofa to sit. So that's the reason whole sofa setup is there for the whole family to sit.
So one part is genetics.
Yeah.
You have seen with your experience that mother-father genetics, people are going to be fat.
Yeah.
But what about high-pressure corporate environments? Fatigue, weight gain, sugar cravings. You know, in the corporate world now, we live in Bangalore. It is like given the stress is normal. Could this be earlier signs of deeper metabolic issues?
देखिए सर, अब तक हमने जो भी डिस्कस किया है फूड वाइज, लाइफस्टाइल फॉल्टी लाइफस्टाइल एंड ऑल, बट देयर इज समथिंग कॉल्ड हिडन स्ट्रेस, subconscious stress, which will increase the cortisol level in your body.
What is this cortisol?
Cortisol is the stress hormone. When you are stressed, the adrenals, which are sitting on the kidney, they will release a hormone called cortisol. This cortisol will increase fat everywhere. आप जब स्ट्रेस हो जाते हो तो आपका मोटापा बढ़ जाता है. That is the reason for it. When you are stressed, you are not going to get sleep properly. When your sleep cycle is not better, again you are going to put on the stress.
Okay.
Inbuilt. It becomes a vicious cycle.
Can you tell the younger generation why they need to sleep?
Yeah. See what happens, a lot of young girls comes to me. To be very frank, if you really divide 10 patients, 7 are women. Young girls.
Why?
The reason here is they will have a condition called PCOS.
Yeah.
What happens in them is the hormones are not released in the correct interval. And the hormone imbalance happens with estrogen and progesterone. They put on a lot of weight. They work on sitting job for a long term. That is also killing them. Again, they put on a lot of weight. Again, they get going in stress because they are not looking good.
Then they don't eat food.
They
Which
don't
is again,
eat food,
is
which
another
again is a stress. So all the wrong habits accumulate over a period of time. They land up in 100 plus kgs. Sir, I really don't know what is happening with me. Uske upar, thyroid. Thyroid is also coming into the body. So thyroid, PCOD, stress, insomnia. ये सब मिला के इतना वेट गेन करवा देते हैं, they can't even imagine they can go to that level. देखो फॉर एग्जाम्पल 15-16 साल की बच्ची जो भी है, if she was 45 kgs or 50 kgs in her 16s, in 25 they become 100 plus. सर मैं इतनी पतली थी, अभी इतनी मोटी हो गई, because you have 5 factors which is causing weight gain. And none of them is taken care. The PCOD is not taken care. The thyroid is not getting taken care. The stress is not taken care. The sleep is not taken care. Sleep is underrated luxury.
Repeat that again.
Sleep is underrated luxury. If you get good sleep, you have the luxurious lifestyle.
What a statement, doctor.
Correct, right?
Yeah.
If you sleep well, 30% diseases are gone. Because sleep is the whole reason. For example, if you don't sleep yesterday night, today you can't work productively.
True.
You get stressed out.
You get angry with your staff.
Obviously. Again, when you get angry, your cortisol will increase. Again, you become obese.
Then you want to do sugar craving and eat high-fat meal.
Yeah, that's the thing.
So people don't realize this, that heart disease, obesity and diabetes are all connected. As a doctor, you know it. As a nutritionist, I know it. But how does improving metabolic health help lower cardiac risk? I'm coming from a perspective of huge number of cardiac cases happening recently.
Correct.
So what is your thought process that telling the public that these three are linked, it's linked to your weight, it's linked to your sleep? What are your observations?
For example, I'll tell you one is in a different perspective. First of all, you're not getting sleep, insomnia. Okay. There is something called obstructive sleep apnea. What does it mean? Obstructive sleep apnea, because the fat deposited around here, the neck, you will have a short neck like this, stuffed neck. Necklace they call it as. Okay? So the 100% oxygen is not going in those patients. In that, what will happen? It means आपका जो भी ऑक्सीजन लेते हो 100% is not reaching to the liver, kidney and organs. जब भी ऑक्सीजन deficient होता है तो organ starts damaging. How is the liver damage manifest? By fatty liver. Correct, right?
Correct.
How is the kidney damage manifest? By rise in creatine. How is the heart manifest? By forming a clots inside the blood vessels. देखो, one thing what God has given is there is no alarming signs until unless the organ is damaged. आपको जब तक पता नहीं चलेगा जब तक आपका 90% of the organ is not damaged. समझा ना? That's the reason whole role of doing annual checkups come here.
Screening is important. Because a body fails only at 90%.
90%. How will you know?
Screening can find that problem even at 5%.
Patient बोलते हैं सर मैं 120 kg हूँ, मैं आराम से एक्टिव हूँ, वॉक करता हूँ, रन करता हूँ, जिम करता हूँ. बॉस आप टेस्ट करोगे तो पता चलेगा ना आपका लिवर कैसा है. आप टेस्ट करोगे तो पता चलेगा आपका किडनी कैसा है. See, nobody is going to know what is inside.
So when somebody walks into your OPD, you ask for all of these tests?
Yes.
And use those tests to whether decide that this person is...
Even we see a lot of clots, blood clots in the legs.
Okay.
Patients who are obese, they have huge legs. When you do a Doppler, there is a test called Doppler, venous Doppler or arterial Doppler. You see the clots in the legs. That is called DVT, deep vein thrombosis.
Yes. And then they go
उनको पता ही नहीं कि DVT है.
And then they take a flight and suddenly die of a heart attack or stroke.
This DVT will throw up, land up in lung. That is called pulmonary embolism. खत्म. So in that way, लोगों को लगता है they are healthy. एक मैं statement देना चाहता हूँ. You please note it, make it loud and clear. Physical fitness is not metabolic fitness.
Physical fitness is not metabolic fitness. Please
आप
expand.
physically fit हो.
हाँ.
बट अंदर से आपका डायबिटीज है, ये है, वो है, सब आपको नहीं पता कि है ये कुछ. Your metabolism is not fit. That's the reason people are dying, right? In the gym, suddenly they have a cardiac arrest.
So you're saying people should discover their metabolic fitness.
Obviously. I may look physically fitness. I may running marathon. I may be doing this, that and all. Who knows that my liver is not working inside.
So always making friends with your family doctor or doing your annual health checkup is a great way to check your metabolic
Obviously,
fitness.
there is no substitute for it. People may think, yeah, unnecessary kharcha hai. It is not kharcha. It is something which detects your disease early, so it can be treatable. Never throw the disease into a place where it is not treatable.
Never throw the disease in a place where it is not treatable, and that's what India does a lot.
Always they do that.
And मेरे को जानकारी नहीं चाहिए. मेरे को जानकारी नहीं चाहिए. इसको टेस्टिंग नहीं करने का, जेनेटिक टेस्ट नहीं करने का, ब्लड टेस्ट नहीं करने का.
बहुत सारे लोग ऐसे डरते हैं कि कुछ कराऊं तो कुछ मिल जाएगा. अगर मैं कराऊंगा तो डायबिटीज मिल जाएगा, कराऊंगा तो बीपी मिल जाएगा.
But we will still send our
पहले तो नींद आती थी, अब बीपी है तो नींद नहीं आएगी. But it is not like that. It is treatable.
I remember meeting a Japanese friend, and he runs one of these health screening firms. And he was saying to me, in Japan, they have the least amount of cancer rate because in World War II, after the atomic bombs were dropped, the government mandated testing from the age of 21 years onwards by all the corporates.
Super.
So if you're working in the corporate, every year your corporate company would make you get tested, and you had a corporate health doctor who would take a ruler and say, boss, this is what you need to do. So they have the lowest incidences of cancer, metabolic disease also in Japan. That's if you see Japan, the only fat people are sumo wrestlers.
Actually, Japan का other side है. The common, सबसे ज़्यादा stomach cancer is in Japan.
Why is that?
That's the preoccupation. वहाँ पे क्या है? The people are more prone towards stomach cancer than rest of the population in the world. इसलिए सबसे ज़्यादा स्टमक कैंसर सर्जरी जापान में चलती है. अब चलो फॉर एग्जांपल हम इसको कैसे बदल सकते हैं इंडिया को. फॉर एग्जांपल 1.3 बिलियन, हमारे लोग तो कुछ भी करें सुनेंगे नहीं. इधर से यू टर्न नहीं लेने का तो उधर ही यू टर्न लेंगे. आप ग्रीन लाइट डालो तो रुकेंगे, चले जाएंगे, व्हाटएवर इट इज. सो व्हाट हैपेंस, इसमें क्या है, इंडिया में क्या है, हर चीज़ को मैंडेटरी कर देना चाहिए. फॉर एग्जांपल आपको कॉर्पोरेट जॉब मिलेगा अगर आप हेल्थ चेकअप करा के आओगे. 30 के बाद कंपलसरी, जस्ट लाइक IT रिटर्न्स. आप जब तक आपके पास 3 साल का IT रिटर्न, आप आउट ऑफ इंडिया नहीं जा सकते. जब तक आपके पास
सब लोग करेगा.
जब तक आपके पास हेल्थ चेकअप का पूरा है,
आप बाहर नहीं जा सकते.
बाहर नहीं जाने का. यू विल नॉट गेट प्रमोशन. You will not get job. You will be sacked.
Doctor is going to get trolled by all the comedians on the internet now. ये डॉक्टर साहब क्या सोचते हैं, पैसा कौन देगा?
So I think even the company should bear that.
I think if you look at Scandinavian countries, the health checkups are mandated by the government.
Yeah.
And it is provided by the government. So I genuinely believe that our nation will get better. And I also genuinely believe that health screening, like corporate social responsibility, will become a mainstay as compared to your Form 16. The company will give it to you. The form will also give you an annual health checkup.
Annual checkup.
So I think this is a brilliant idea. But coming back
That's not expensive actually. To be very frank, it's not expensive when you do together as a master health checkup. I'm not promoting any health checkup. I'm just telling you. Because आपको for example,
sir, in our country, the cholesterol profile is the cheapest in the world.
Correct.
Because of volumes.
Correct.
So the moment we get to volumes,
only expensive are vitamins. Rest are cheap. Even the eco is cheap, whatever it is. So, but what happens is, what I want to say is, when the damage is early, we can prevent it. And what happens many of the times, they come late. Sir, अगर मुझे पता होता तो मैं पहले ही करवा लेता. This regret we should not hear.
You know, bariatric surgery is seen as drastic.
Yeah.
But I also believe that worsening diabetes and fatty liver is also very drastic.
Yeah.
Okay. At what point does excessive weight stop becoming cosmetic and now becomes a medical emergency?
Yes. When you are unable to climb one flight of stairs, you get breathless, it becomes an emergency. When you are loud snoring, जो बाजू घर वाला भी नहीं सो पा रहा है आपके snoring से, it becomes an emergency. When you are...
Is this one of the questions you always ask your patient? You must be 100% snoring. They will say, हाँ doctor, आपको कैसा पता है?
I always tell them, when I ask this question, you are snoring, I will see wife face. That tell me the answer. बहुत snoring, sir. बहुत स्नोरिंग सर.
Then you know candidate.
आप उसी रूम में सोते हो, बाजू रूम में सोते हो? सर बाजू रूम में भी साउंड सुनाता है सर. Then it's in a medical emergency.
So many people believe that bariatric surgery is only for the extremely obese. Who is it meant for?
Bariatric surgery is not only for obese, extremely obese. When you have metabolic issues, which is troubling you, which I feel it is going to affect your heart, lung, kidney in long term, definitely we want to address those. And I think we have set a protocol like 32.5 is a BMI, where we plus BMI.
Has any celebrity or anybody come to you and like they're not a candidate and forced you to do bariatric surgery?
Many people do that.
Especially women, right? They're like they want to be
Many
slim
people
trim.
try to bribe us.
Okay.
Bribe मतलब पैसे नहीं.
हाँ.
सर प्लीज कर दीजिए सर, प्लीज आपका क्या जाता है सर, आपको पैसे मिलेंगे. मैं बोला बॉस, यू आर नॉट क्वालिफाइड, यू कैन स्टिल वर्क आउट. Because I do the body mass analysis in my BMI machine. There is something called Korean machine which we have. बॉस आपका BMR बॉडी बेसल मेटाबॉलिक रेट सही है, तो आप स्टिल लूज कर सकते हो. बट आपका BMR स्लो हो गया तो मुश्किल है. बट स्टिल योर BMI शुड बी 32.5 के ऊपर ही होना चाहिए हम सर्जरी करने के लिए. और कोई आते हैं 29. आजकल क्या है, लड़कियां बिकम, मैं बोला इंस्टाग्राम वर्ल्ड, 65 kgs दे कम लास्ट था सर, प्लीज सर्जरी कर दीजिए, आपका क्या जाता है.
Because they want to be 40 kgs.
They want to be 45.
So doctor, what are the side effects of that?
See, when a person who doesn't qualify for bariatric surgery, they shouldn't be doing bariatric surgery because you will be losing too much of muscle along with fat.
Because
muscle is life.
Right.
आप muscle है तो आप 60-70 तक आप healthy रह सकते हो. If you lose muscle at such a young age, you are going to become crippled at 55-60 years.
So bariatric today is minimally invasive, quick, and you do laparoscopy. I've seen the dances that you do with your patients post coming out within 24 hours. How has it evolved over the years that you've been in practice?
See, bariatric surgery, when we started, there was a lot of fear among the surgery. Surgery very scary, kuch ho jayega. By doing so much amount of surgery, so much training in different parts of the world, what I feel is we simplified the surgery. बोलते हैं ना, algorithm is cracked. वैसा हम simplify कर दिया surgery. Now we don't worry about the complications. जो हमारे जो सर्जरी के स्टेपलर्स हैं, दो इंस्ट्रूमेंट्स हैं, they have become so fine. So complications का सवाल ही नहीं उठता. And हमारे skills, suturing skills has evolved a lot. और हमारी जो सर्जरी की टीम जो है, सब एक ही काम करते हैं हर रोज. जैसे आप डाइट देते हैं सबको, हम do the surgery every day. Once you join us, we'll get to know. So the precision, the quality, okay, the results improve. If you do the same thing, you will definitely going to be better in that.
You become master at it.
So that's how from 13 years we're doing it, and I think we have mastered it.
What does a typical surgery day look like for a patient, and what does the recovery look like?
For example, patient ने surgery fix किया, हम बोलेंगे one afternoon before the surgery you get admitted. But tomorrow is the surgery, you get admitted in the afternoon. We run all the tests. We check your liver, kidney, heart, and everything. If green signal,
they can't eat, right?
Huh?
They can't eat that evening, right?
Yeah, liquid diet. From midnight, nothing. NPO. So, if the green signal come from cardiac, lung, anesthesia team, sir, yes, we can go ahead. Then we plan the surgery next day. Surgery takes approximately 30 to 45 minutes.
That's it.
That's it. That's what I sell now. We mastered it. So we do it quite faster. So within 2 hours.
Diet counseling takes longer.
Yeah.
I take 1 hour to do diet counseling. You finish bariatric surgery in that time.
45 minutes max to max. We're done with it. Within 2 hours, we'll mobilize the patient. So 12 बजे सर्जरी हो गया, 2 बजे patient is walking already. हर घंटा उसको वॉक कराएंगे. The reason for is clot नहीं होना leg में.
Okay.
There is something called peripheral heart here.
Yes.
ये हार्ट ऐसा पंप करता है, आर्टरी से जाता है वेजल, फिर वहाँ से भी वापस आना है आपको वेन्स के थ्रू. फॉर दैट यू हैव टू वॉक. दैट्स द रीजन ऑफ वॉकिंग पोस्ट सर्जरी, एनी सर्जरी. आप वॉक करने लग जाओगे तो हार्ट यहाँ का पंप जो है ठीक तरह से पंप करेगा और ब्लड वापस आ जाएगा. सो आपके ऑर्गन्स का जो ब्लड सप्लाई टेम्पररी हैम्पर हुआ था सर्जरी के कारण या बेड रेस्ट के कारण, दैट विल एस्टैब्लिश अगेन. You will recover faster. That's the whole concept of making them walk post-surgery.
And then they walk post-surgery, and then when are they discharged?
Next day.
And what does the post-surgery operative care look like?
Post-surgery is all about diet and
so
discipline.
Is it because I know a lot of bariatric patients have come to me and after 5-6 years, after having this experiential wisdom of doing crappy diet after the bariatric surgery, and they've got a lot of issues. So can you explain why it's important for post-bariatric surgery to get a planned nutrition?
Yeah. Post-bariatric surgery, see, surgeon job is only 1 hour. That's what I said, less than 1 hour. It's all about the nutrition role comes here. Post-surgery, they should be in regular touch with me, with my nutritionist, and with my trainer also.
How often do they need to meet you as a doctor?
Post-surgery, after 1 week, we just
Yes.
check the small holes, and we don't remove any stitches. It's all observable.
Okay.
And patient can take bath on the same day of surgery.
Wow.
We put a small plasters, waterproof plasters. And after 1 week, we just come and check the wounds, the small keyhole which we put. After that, every 3 months once, they should be in touch with us. They should do the health checkup. I mean, what CBC, LFT, RFT, whatever it is they have to do. And
Do
they
you
have
check
to
the
meet-
fat percentage and the weight
Obviously,
again?
I check.
Okay.
I check the visceral fat also.
Okay.
I check the, what do you call this, performance score. On the top, if you see the BMI,
Correct.
on the right side, there is performance score. वो भी
Fitness
देखते हैं,
score and
बड़ा
all.
है नहीं बड़ा.
Yeah.
वो नहीं बड़ा तो उसको डांट पड़ेगी.
Hmm.
Boss, you are not walking.
So you still prescribe exercise after with your trainer?
100%. And हमारे पास 2 trainer full time है.
Why is that?
To prevent loose skin. To increase the muscle.
Okay, so you want, when the fat goes down, you want muscle coming in that place.
हाँ, muscle, देखो, muscle is not so easy to get back into that place. Because whenever you do a weight loss surgery, you are going to lose some muscle. Fat to lose होगा ही होगा.
So you always like a bariatric person who has worked out and come to you because you know he's fit.
Yes. I'll tell you one thing, whatever. When you fat loss होगा, थोड़ा सा muscle loss भी होगा. ये muscle loss prevent करने के लिए हम protein powder देते हैं 1 साल के लिए. And ये muscle toned होना जरूरी है. Muscle bulk maintain करना और toned होना. Because skin is sitting on the muscle. When you lose muscle, the crimpling of the skin happens. There where loose skin happens. हम चाहते हैं कि हमारे ट्रेनर से 1.5 महीने के बाद संपर्क करें. हिंदी में.
What about the dietitian part?
Dietitian तो lifelong touch में रहेंगे और we have WhatsApp groups and all where post surgery I add the patient in the group. Each group has 500 patients, operated patients. So dietitian है, मैं हूँ, old patients हैं. तो old patients will support the new patients. कुछ भी small रहा है. For example, you have done bariatric surgery with us. So आपको 1 महीने के बाद एक डाउट आया तो ये खा सकते हैं नहीं खा सकते. Take a picture, put it in the group. Someone will solve the answer because वो बोलेंगे ये नहीं खाना. In the group. So we need not come for small things to us. 3 months once is
In
enough.
fact, my wisdom back to the world out there is this, that eating is also a psychological activity.
Yeah.
It gives you physiological response. So it feeds you, guides your metabolism. But when you do the bariatric surgery, what patients have not understood is they are still the same person who ate the same way previously. So they have to work on the psychology part of eating. In addition to the physiology, because the enzymes, the digestion, the vitamins, the minerals, the higher protein requirement is a huge factor. And correct me if I'm wrong, the quantity of meals drastically reduce in size.
yes.
Appetite is not there. In fact, patients have told me they feel like puking if they go for a buffet. In fact, any bariatric person says, I don't want to do buffet anymore.
Actually, बहुत सारा खर्चा बच जाएगा आपका खाने पीने का. So what happens is basically आप पहले quantity खा रहे थे, अभी quality खाओगे.
I think quality is a very important word.
For example, आप पहले इतना खा लेते थे. You'll be working on the volume. नागार्जुना गए, इसमें रामबस में सांबर में से राइस थोड़ा, रसम में थोड़ा, कर्ड में थोड़ा, ये सब आप खाओगे. अभी आप इतना ही खा पाओगे. So quantity is less, quality is more. So eating in the right way. And what happens is post-surgery, even the hunger comes down. You don't feel like eating much.
Correct.
That is one thing. Because जो भी patients हमारे पास आते हैं जो 180, 200 kg, they will be eating 6 times a day. जब जाके they become 200. So post-surgery, the ghrelin comes down. That hunger hormones. Ghrelin is a hunger hormone. And number 3, the hormonal changes होके fat अपने आप से पिघल के motion के through आएगी. When you go to the toilet seat, the sticky stool is coming out. Fat is burning and coming there. That's how the bariatric surgery patients.
So what are the other post-surgical complications or compliances that the patient should look for?
I always feel if they are in regular touch with us, they are not going to lose muscle. Don't lose muscle. Muscle is very important. Muscle is life. So that is one thing. To maintain the muscle, we have a trainer and dietitian and all. And vitamins also. Especially People say that vitamin D is very important. Yes, vitamin D is most important for many biochemical reactions in our body. If you remove the biochemistry book, you see hundreds of reactions where vitamin D is a catalyst.
Yes.
Correct, right?
Yeah.
Along with it, you can take omega-3, magnesium, whatever you want, but still, vitamin D is a very key. B12 is also very key for the neurological thing, because nerves be both important. So I think the small corrections can be done in the follow-ups.
We do have a lot of your patients coming in who are with cholesterol medication, diabetic medication, hormonal medication, PCODs and all that stuff. Now you're the bariatric surgeon. The logic is that most of these conditions will reduce or, if not, luckily disappear.
Yeah.
Because you've addressed a key concern.
Correct.
Does medication need to be changed in such a thing? And do you do it, or do they go back to their specialist doctor?
Yeah. Post-surgery, the first thing I'm going to stop is two things. One is your diabetic medication I stop. Number two, I stop the machine which they use, BiPAP machine, sleep apnea. You see a lot of obese patients with snoring. They'll put machine. The pulmonologist will put machine. I stop that machine. Slowly, even the blood pressure medications, we taper it. We don't stop the blood pressure immediately. Slowly. Even the cholesterol medication, slowly we taper it. Slowly we stop it, and definitely we ask them to go back to their primary physicians to adjust the doses, because they may no longer be needing the same dose what they were required before. And any dose is per kg body weight. You agree with it?
Yes.
For example, आप 100 kg हो, मैं 60 kg हूँ, मुझे बीपी की एक गोली लगेगी, आपको 1.5 गोली लगेगी. You agree with it?
Correct.
जैसा आप weight loss होंगे, per kg body weight भी कम हो जाएगा. Automatically the dose is going to go down.
So, doctor, we have talked about medication and then lowering the medication, and that's a great effect of bariatric surgery, and it helps millions of people in severe obesity. But do primary physicians of these obese patients, if they want to do bariatric surgery, is there a resistance or like, no, you should not do this? And how do you counter that?
Actually, it starts with 10 years back. 10 years back when I came to Bangalore, there were a lot of physicians who were telling, like against it. Why bariatric surgery? The results are not good. Patient is going to die. Patient is going to have problems and all. I did few of their patients. The patient went back to them, gave feedback. Sir, I am very happy. थोड़ा कम खा रहा हूँ, but I am happy. I'm walking. My sugars come.
That's anyway what your doctor wanted first to eat less.
So he will say, oh, इतना अच्छा result है क्या? मुझे पता ही नहीं है सब चीजें. Okay, 2 patient गए, 5 patient गए, 6 patient गए, 10 patient, 20 patient गए. Then they started seeing results. उसके बाद, now here I am sitting after 10 years, operated 56 doctors in Bangalore.
Oh, the doctors also do bariatric surgery now?
Yeah. 56 doctors in Bangalore are my patients. I proudly say that. 10 साल पहले कहाँ resistance था, अब देखो. Because
so if a doctor,
they start seeing results.
So if a doctor does bariatric surgery and you have certain that is the correct candidate for bariatric surgery, and the doctor who's extremely knowledgeable has done it, it means from a perspective that, yes, this is a proved medical procedure.
Obviously.
Any complications in life that people could expect from bariatric surgery?
Maybe, I don't know, I should say this as complication or not. The quantity of food comes down.
That's a huge complication for a lot of people.
So number 2, slight gastritis they feel.
So gastritis happens because of what?
It can be faulty food also what they're taking.
Correct.
As you say, and many inflammatory foods we can remove.
Correct.
I can send back to you. You can do the.
In fact, after bariatric surgery, I insist that some of my patients do the food intolerance test.
Yes.
Purely from a vanity perspective.
Correct.
That abhi chota kiya, like, sir, if you live in a 3-bedroom house, you can throw things around.
Correct.
But if you live in a 1-bedroom house, you have to be very organized.
Yes.
You have to know where to keep what. Same thing with the diet.
Same thing, obviously. Even I started suggesting the food intolerance profile nowadays. I tell them whichever is in the red, don't eat it.
Correct. Okay. Simple logic.
30% आपका अच्छा हो जाएगा. And obviously gluten, dairy. If you are okay, you eat it. Otherwise, if you feel it is not indicated, don't eat it. And just check with that, remove that red thing and see. If it is really working, it's okay. And many of the times what happens, they do well. Surprisingly, they do well. They remove the red part in the food intolerance profile and they become better.
No gastritis and everything.
It comes down. Many of the times bloating is because of the inflammatory food you eat.
Any enzymes have to be given to bariatric patients?
No. That's the biggest misconception. the food goes into the normal tract only.
Mm.
Understand, right? The enzymes, the liver enzymes and the pancreatic enzymes are going to mix down there.
Mm.
May not early in the intestine, but little late in the intestine. So there is no deficiency in enzymes.
So you allow protein powder.
Yes.
What about probiotics?
Yes, we allow.
So patients are living a normal life basically, but improve the quality of what you're eating
instead of quantity.
What about alcohol? It's never recommended before also, and I am assuming also
See,
after.
As a doctor, I should never recommend alcohol.
Yeah.
So after surgery, if the patient wants to do something social, after 6 months, yes.
Okay.
And even the quantity of alcohol, जो आपको उतना kick देता था, जैसे 2 packs में kick देता था, वो 30 ml में मिल जाएगा.
Okay.
So it's one way it is good also for us. Quantity कम हो जाए.
Speaking on the happiness of a peg, when researching your profile and podcast, I discovered that bariatric surgery is covered by insurance also.
Yeah.
And many patients do not know this. So is there a mind thing over here, or is it a communication issue?
What happens is initially obesity, they used to think it as a cosmetic issue. Now everyone knows obesity is not a cosmetic issue, it's a metabolic issue. So even the insurance people started recognizing it as a metabolic issue, and the insurance is covered. You should have a particular BMI, particular weight, and all this stuff.
In all of the cases that you do, infertility, PCOD, PCOS, sleep apnea, what are the changes that you have seen?
PCOD patients, what is PCOD? Basically, cyst in the ovary. So imbalance of hormones.
Insulin resistance.
Insulin resistance. They have hair, facial hair here.
Hirsutism, yes.
So hirsutism. So they'll not be menstruating 6 months, 1 year before surgery. Post surgery, within 3 months, the menstrual cycle starts getting regular. You lose weight, good amount of weight.
So even fertility improves.
Yeah, fertility. We have a lot of patients who conceive naturally with failed IVFs before.
With failed IVFs
before.
So obesity is massive on a lot of health complications.
Yes, it's a burden. It's not only a burden on the person, it's a burden on the health economy of the country.
Do you have any patient who has become your brand ambassador?
We have so many. They themselves advocate the surgery.
Okay.
Yeah, what we do is, when we do a surgery, one patient per city becomes our brand ambassador. Okay. Not one person per small city. For example, if you take Ballari, this small place, one person from Ballari will become brand ambassador. He keeps telling about it, sir, I've done that like this. So whoever has query from there, we'll ask them to go and meet him. कुछ भी डाउट रहा उधर ही सॉल्व कर लो 80%, 90%. जो भी नहीं रहा हम सॉल्व करेंगे. So in that way, they seeing is believing. Everyone knows about it. So maybe I may be telling all rosy words to sell those things. But if you hear from the patient's mouth, then they get satisfied.
I think not one thing about doing this podcast was that when I first got the brief was like, Ryan Fernando, why would you talk to a bariatric surgeon? He's going to be your competition. But when I do nutrition for weight loss for morbidly obese people, hand on my heart, I know I can't fight it. The psychological power of food or the genetic predisposition to having parents and grandparents that are obese.
Correct.
Food can control only that much.
Yeah.
And so, I was like preparing my notes and all, but then there was one part which is modern medicine is really advanced.
Correct.
But the elderly people, would they benefit from bariatric surgery? And if so, how? Because they don't want to do it. हमारा तो ज़माना गया.
हाँ. See, actually, sir, हमारे पास मैंने बोला था young girls who want to get married and all this. There is another spectrum of the patients who are 55, 60 years plus, who are not even able to walk a small distance because of severe knee pain they have because of obesity. And they have osteoarthritis along with obesity, added obesity. They can't even go to the washroom. Sir, जिंदगी जहन्नम हो गई. हम washroom को भी नहीं जा सकते. थोड़े से steps भी नहीं चल सकते. उस तरह के patients को हम surgery करते हैं. Where once they lose weight, the pressure on the knee joint comes down. The pressure on the spine comes down. The breathing difficulty eases off. They can walk little more. We have a lot of patients like this. If you are really willing, we'll do one separate podcast where we make them sit 100, 200 patients of us. Speak to them individually without my nodding. I'll not be in there in the room. शायद मेरे सामने अच्छा बोलते होंगे, but मेरे पीछे पूछ. So in that way, they develop the quality of life. उनको अच्छा होने के बाद, they suggest a similar kind of person in their adjacent neighborhood. So, I'm doing well, you also do it.
I think the biggest thing would be on the knees, because a lot of old people like to walk, they like to travel, they like to value the money that they have. And when I travel nowadays, I see so many people taking wheelchairs.
Correct.
So we both talk about transformation. So I want to, you have the experience of seeing thousands of obese people. I do thousands of people in their transformations. If both of us had to sit down and convince India, what are the habits or mindset shifts that will help them from going into relapses? Or what is it that they need to do?
See, sir, actually what happens, बचपन से जो हैबिट आती है ना बॉडी में, उसको अनलर्न करना बहुत मुश्किल है. But what happens is, we should always give them some perks by doing this. For example, we should give them shorter targets.
Okay.
So, for example, a patient comes in with the knee pain. We'll tell them, you lose 5 kgs on show, and we quantify the knee pain score. The patient was complaining 8 out of 10 pain. That comes down to 6, 5, 4. Post-bariatric surgery, I have a patient, remember that. He exactly stays in front of my clinic. His house is near my clinic. He's a young guy. He's 36-year-old guy. He's telling, sir, I am unable to walk. बहुत ज़्यादा पेन हो रहा है सर. इतने ऑर्थोपेडिशियन के पास गया. उसका वेट 140 kg था.
Obviously.
मैंने सर्जरी किया. Within a month, he was so happy that he said, मेरा पेन चले गया. उसका मतलब क्या है? उसको कभी ऑस्टियोआर्थराइटिस था ही नहीं.
It's just
उसको सिर्फ ओबेसिटी था.
40 kgs is 220 kg bags you put on a flight.
Right.
You put 4 of those on your shoulder.
जैसे वेट लॉस हो गया, मैं आपको दिखाऊंगा एक पिक्चर. He's riding a bike now. Obese sports bike. So whatever it is. So that's how you get a relief. You get a massive relief.
You mentioned बचपन से habits होता है. We are today seeing more babies and toddlers with early sign of obesity. One is, you already told me that 4-year-old baby has been operated on.
Correct.
But how early is too early to act? And what is the role of parents? Because what I see, like if I tell a parent, go to the dermatologist, your child has lichen planus or has eczema or psoriasis. So parents are like, nahi, chalega. So in this obesity issue that we have today, where does the role of the parent coming in and how early is it?
Sir, childhood obesity is going to be a newer pandemic, which is going to come soon. Because अब तक हम COVID pandemic से deal करें, अब childhood pandemic. Because childhood obesity is going to be a newer horizon again. Because kids are na, before our childhood, we used to play cricket outside. We never used to be at home.
Correct.
बहुत जबरदस्ती हमें पकड़ के लाके घर में बिठा दे, घर पे आना है तू, अभी पढ़ाई करने का टाइम है. अब बच्चे घर से बाहर जाते ही नहीं.
Yesterday my son came home at 8 o'clock at night. I'm like, shabash beta, tomorrow you come at 8:30 at night. We want them to be outside playing.
Because we want them to play. I think physical activity has become this one. And one more thing is, this craving in the night times. They wanted burgers in the night, midnight, 11 o'clock. My son come and say, Papa, ek burger order kar do. We have to order from some place.
So I think parents also need to be disciplined.
Discipline के at least हाँ ठीक है, cheat meal is okay once and twice in a week, not hard dose. अब हम लोग क्या कर रहे हैं, 4 दिन घर से बाहर खाना मंगवा रहे हैं. That's a very wrong habit. बच्चों को हम डाल रहे हैं इसे आदत. And even high calorie drinks what they drink.
I was at Goa airport the other day and this guy is feeding his toddler in a pram. He's buying an aerated beverage. I won't take the name of it. The black wala beverage. You know what it is. He's buying 1 can of that and a packet of chips. I'm telling you, doctor, the toddler was not more than 2.5 years of age. So I think obesity is also a fault of maybe the parents from an environmental perspective. Maybe genetics, you're born into an obese family with bad genetics. Recently, somebody was at a party and they said, would you like to have a cigar? And my son was at that party. He's 12 years old. I says, no. Because he will see what his father does.
Yeah, correct.
I took up martial arts 3 years ago. My knees hurt. I can't keep pace. My knuckles hurt. but my son is super impressed that his father is doing martial arts because he's also doing martial arts.
Good.
I think parents lead by example.
Correct.
So if you are going to be ordering that pizza and burger, you can't expect your kid to not have the same requirement.
Correct.
If you are not doing physical activity, how can you expect your child to play?
Correct.
So I think the message to people out there would be that in the younger years, even if your child is in the heavier level, the behavior of the parents should be one of inspiration, one of doing, one of motivating your child by doing instead of saying.
Correct.
Now, if somebody is watching this episode, doctor, and they're feeling stuck, maybe they're burnt out by Ryan Fernando's diet advice. When Ryan Fernando ka diet karwaya, kuch nahi ho gaya. I tried some medication, or I went to the gym, hired a trainer for 1 year. And they're not being able to budge that very high BMI. What would you say to them as their next steps?
So next step, I'll do a body mass analysis. Then I'll see the amount of visceral fat they have. And my first thing will go on performance score. And the second thing which goes on BMR, basal metabolic rate. मुझे लगा अगर उसका 1000 कैलोरी BMR कम है, तो मुझे लगेगा when he is 32.5 BMR, then I'll straight forward go to surgery. I'll not do anything else. अगर उसका BMR अच्छा है, तो मैं बोलूँगा फिर से रैन ब्रेनर के पास भेजूंगा कि कुछ देखो इसका BMR ठीक है, शायद ये बर्न कर सकता है, कुछ और देखते हैं.
So doctor, before I let you go,